Good day, everyone. I am Sandra Lane Siradam, and we will be tackling all about the online databases or journal articles related to intervention and provision of maternal and child care. Before proceeding to the discussion proper, let me first ask if anyone from the class knows the rationale or the reason of knowing the trends related in the intervention and provision of maternal and child care. So, diba, as previously discussed, as a sort of review, we have the so-called maternal morbidity and mortality, as well as the child mortality and morbidity. So, through these journals, which we will be discussing, such issues are at most prevented or simply be minimized. Good maternal health care and nutrition are important contributors to child survival. Maternal infections and other poor conditions often contribute to indices of neonatal morbidity and mortality, including stillbirths, neonatal deaths, and other adverse clinical outcomes. Considering the fact that most maternal and child deaths are preventable using current knowledge, the burden of mortality and morbidity is unacceptably high. As what we have in our notes before the first discussion of Ma'am Berna, all about the current trends of maternal and fetal morbidity and mortality. So, the majority of maternal deaths occur during labor, delivery, and the immediate postpartum period, with obstetric hemorrhage being the main medical cause of death. Hypertensive diseases, infections, obstructed labor, and abortion related complications are the other causes of maternal mortality. The maternal mortality ratio is approximately 500 per 100,000 live births in sub-Saharan. While many factors contribute to maternal and neonatal deaths, one of the effective means of reducing this burden is to know the trends of action in response to multiple conditions. So we need to know the trends today kung paano nila ginahandle ang multiple nga mga condition so that maaram kita kung ano natin mga approach when we are faced with that kind of situation. After all, because of the researches and the journals that we have today, it paved an impact to the practice that we do today. So what can we see from the previewed photo? So it shows the Neonatal Intensive Care Unit or NICU, or most commonly known as the Newborn Intensive Care Unit. So these are the units specially and carefully designed to cater to the needs of newborn babies who need critical treatment. So what are some equipments that you can find inside a neonatal intensive care unit? So few examples are the infant warmers, incubators, phototherapy, monitors, feeding tube, IVs, lines, and ventilators. So the average stay of a preterm or a neonate is about 13.2 days if they are born in full term. However, infants born earlier than 32 weeks or the premature ones stay in an average of 46.2 days. So, okay, actually we have prepared 10 journals and today we'll be tackling the first one. So the title of the first journal that I will be tackling is about research trends of follow-up care after neonatal intensive care unit graduation for children born preterm. So it is a scooping review. So premature infants, as what we all know, are a high-risk group for delayed growth and neurodevelopment disorders. And some have neurological sequelae or the consequence of neurological, such as delayed neurodevelopment, decreased intelligence, and cerebral palsy. So the factors that affect the growth and neurodevelopment of premature infants include birth weight. So kung ang iyang timbang during birth is overweight ba siya or lower than a normal weight of the baby during birth. Then gestational age, if preterm siya or full term. Then the APGAR scoring. As we all know, APGAR stands for the appearance, pulse, grimace, activity, and respiration. So, di ba, mag-APGAR scoring man na after sa birth sa baby. So, maka-affect gihapon na sa growth and neurodevelopment of the baby. So, the next factor is the cardiopulmonary resuscitation or CPR at birth. So, during CPR nimo sa birth sa bata, maybe may na-touch ka or you put too much pressure during conducting those. Then other factor is the breastfeeding, and then as sa ventilation pod, and then last is the length of hospitalization, among others. So according also to the paper, growth and development interact not only with the biological and intrinsic elements of the child, but also with the environmental surrounding of the child. And it changes continuously. So meaning it is not limited sa kung anong biological makeup sa usa ka baby, but it also affects sa environment nga ada ang baby. So as what the research said, in particular, the development of infancy has a significant influence on the interaction with the main caregivers as an external environment. So it has to do with the caregivers or the nurses that the baby has been handled. So therefore, there is a need for follow-up care for infants who have graduated from the neonatal intensive care unit or the NICU. So after the NICU graduation, so who among the groups of people are the most affected ones? So, di ba, ang pinaka-affected group of people during that time sa NICU graduation is the parents, because they will be clueless kung paano i-handle na an era child, because all those time nga nagstay sila sa NICU, which is the average is 46.2 days as mentioned before kaniha sa previous slide. So di ba silaan kukurian pag-handle sa era baby, because they don't know paano na i-handle an era baby, because all those times is an era caregiver talaga ang nag-handle sa ilaha. So as what you can see with the slide, so di ba the father is questioning his wife rather. So he says, what should we do after an NICU, honey? So di ba they are clueless. They don't know what to do. So parents of infants born prematurely face the challenging burden of taking adequate care of their children, as well as acquiring an appropriate role as a parent after being discharged from the NICU. So, di ba, stress na nga ni panganak, stress paliwat after sa panganak sa mother, may da pa siya i-deal nga problem afterwards. Then particularly transitioning from hospital to home for parents is a precarious experience. Prior research has reported that they have experienced increased levels of stress and expressed feelings of incompetence such as anxiety and concern about the discharge of their infants from the NICU. Of course, they will experience stress, 'di ba? Dugan pa sa sa mga steps nga era dapat i-handle, may responsibility na sila daan as a parents, then nagdo-double na nila responsibility because ang ilang child nag-undergo sa NICU. Then may postpartum depression pa mother. So unsaon na lang, di ba? So parents of infants born preterm sometimes fall into depression due to difficulties in the process of becoming accustomed to the formation of attachment and the peculiar care of infants after an ICU graduation. So most probably, maujud na ang mahitabo if dili ma-handle pag-upay ang infant sa mother. Then the research also suggested materials to be used in assessing the family as well as the infant. So this is the aftercare after the NICU graduation. So they conducted research in this. So the elements of follow-up care after neonatal intensive care unit graduation are as follows. So ang pinaka-first nga category nila under element is the developmental monitoring. Then the contents in this category are the routine development surveillance, the developmental monitoring, remote monitoring of preterms, growth parameters, developmental milestones, as well as checking the weight, length, and head circumference of the infant. So, mauna ilang i-assess. And then, another element to be assessed during this aftercare check-up is motor development, cognitive development, catch-up growth, gross or fine motor, cognitive linguistic behavior, social interaction, as well as stimulating activities and toy safety. Then under the element of feeding and nutrition, they encourage or support for breastfeeding towards the mother, and then nutrition, achieving energy, protein, and mineral needs, especially for those infant or children nga at birth is mas lower or mas lighter sila compared sa normal nga infant. And then afterwards, monitoring the breastfeeding and then complementary feeding practice. Another element under such assessment is the parenting support. So the contents of this is learning, caregiving, and parenting. So mag-conduct sila og kanang health teaching plans, and then mga instructional materials or in practical demonstration for the parents. Home care over activities as well, hygiene practices including bath, massage, and diaper care, facilitating early recognition of danger signs, as well as teaching them how to care for an infant. Then another element is the parent care. Then the contents are as follows: parental role and development, psychological consequences of a preterm birth and infant hospitalization, need for social and professional supports which appear to reflect parental challenges, parents' mental health, as well as the parents' questions and concern. And then the another element is the attachment. Its contents are development of parent-infant relationships and parent-infant interactions. The last element is the family-centered care. Then the contents are person-centered care, individualized, family-centered. So figure 2 shows the classification for intervention of follow-up care after NICU graduation. So previewed in the photo is the intervention period of the medical practitioner during the follow-up care. So we have here 2 weeks, and then 3 months, then 3 years. Then for post-test, we have 2 months, 3 months, 12 months, and then 24 months. Then another graph shows the intervention method of the healthcare worker during this time. So we have multiple of intervention method. Among those are the home visit, telephone, video call, as well as mobile application. So it is a combination of face-to-face method and then the use of technology. So it is useful, especially today that we are experiencing the COVID-19 pandemic. So face-to-face are limited. So through telephone, video call, and mobile application, the patients or the infant is monitored. So another table shows the characteristic of follow-up care after the NICU graduation, as previewed. So the result of this study or the journal confirmed that home visits, on-call phones, video phones, and mobile applications were used as intervention methods for follow-up care after NICU graduation. The common point is that a follow-up care service centered on patients rather than provider-centered care is possible because of the limitations in human and financial resources and difficulties in health service accessibility. It is not easy to provide health related interventions for children born prematurely and their families, particularly in the coronavirus disease or the COVID-19 pandemic. As I had mentioned before, non-face-to-face intervention has become necessary for the continuation of health services for a medically vulnerable group such as born children born as premature infants and their families. A web-based intervention such as a video phone and mobile application is a method that can be expected to have a lower cost and greater impact while being a non-face-to-face intervention. Therefore, various media should be developed to enable interaction between children and their families and health professionals in web-based intervention for effective follow-up care after an ICU graduation. So, di ba nagtackle man ta sa nursing informatics about those application, web-based application nga pwede nato ma-use in dealing with our patient. So, if we are located far from them, we can also monitor them. So, di ba kay ang mga hospitals ron kay murag full pack na siya for patients nga naay COVID. So, ang tendency is dili na jud mafokusan or ang mga facilities is not enough for them. So, the intervention in such cases must be also upgraded. So that is it for my report. So any questions so far or clarification, you can raise your hand or directly speak and open your mic. Thank you.